According to the work titled Vaccination Disparity, Quantifying Racial Inequity in COVID-19 Vaccine Administration in Maryland by Stephanie Cordana and others, in May of 2021, the United States had the highest number of COVID-19 deaths and infections. There were more than 32.5 million confirmed cases and close to 580,000 deaths. But how many white people were affected compared to people of color? I'm Alyssa Panzer, and today, alongside my partners, we will discuss racial disparities with COVID vaccines within Maryland. Despite this being an issue in many states, I wanted to take a look into this issue within Maryland because my partners and I are currently residing in College Park, Maryland, and many of those that will listen to this podcast are likely to be students at UMD or living in Maryland. First, I'm going to begin by discussing some research done by the work I mentioned earlier by Stephanie Cordana and others, so this next section and the rest of what I personally will be discussing is all sourced from this work. People of color are far more affected by COVID and the pandemic, with a reported 450,689 COVID-19 cases and 8,622 deaths as of May 5th, 2021. Within Maryland, the majority of these reported cases took place in Prince George's County, otherwise known as PG County, and PG County is heavily populated with the Black community. The Black and Latina community don't make up a huge percent of Maryland's population, with the Black community only making up 31% and 10.4% being the Latina community. This means that the rest of the percentage is mainly white in Maryland, and despite the low percentage of the Black and Latina community populating Maryland, they are the two leading groups with COVID infections. In December 2022, Maryland came out with vaccines and started giving them to the public. The research by Stephanie Cordana and the other authors isn't just statistics that they've gathered. It's also a study to see the distribution of these vaccines in relation to race. The results were based on the proportion of deaths to the population vaccinated per county. In other words, they're looking at the vaccination disparity per county. And the results of the study indicate that in Maryland, the top two counties with the highest Black and Latina population are also the top two counties with the most COVID cases. These findings make it clear that racial disparities are an issue within COVID vaccines in Maryland. And is Maryland doing anything about it? Now I'm going to pass the mic to Sarah, who will be discussing what Maryland is doing to help resolve the issue.
Alyssa, thank you very much for bringing this topic up. COVID has definitely taken a toll on our community, but it has unfortunately affected some groups of people more than others. The state of Maryland recognized that and implemented policies and launched initiatives to combat that. As published in the Legal Defense Fund, Kesha Moore, a senior researcher, reported on March 1st, 2021, the Governor, Larry Hogan, announced Maryland's plan to improve equity in vaccine distribution. This plan includes a public-private partnership between the state's health department, the University of Maryland Medical System, and Johns Hopkins Medicine. The goal of this partnership is to focus on vaccinating the most vulnerable communities in Baltimore. The state's Vaccine Equity Task Force, led by Brigadier General Janine Brickhead, is implementing this plan to expand access to the COVID-19 vaccine in underserved and hard-to-reach areas. Through their efforts, the state has established vaccine clinics in vulnerable communities and hosted community outreach events to increase the public knowledge and confidence in the vaccines. The Equities Task Force goals are to partner with local health departments and community stakeholders to increase access to COVID-19 vaccines and bridge the health outcome divide throughout the state. This event is being achieved through increasing vaccination sites and partnering with community organizers. Factors considered in deciding where to deploy the task force resources include population over 65, income, unemployment rate, education, single-parent households, housing density, access to transportation, COVID cases, minority composition of the community, and vaccination rates. This equity plan is an important step in ensuring that everyone has access to the COVID-19 vaccine, regardless of their income, location, race, or socioeconomic standing.
Although Governor Hogan and the Maryland government have already taken valuable steps to reducing racial disparities in vaccine distribution, the state still has room for improvement in the Vaccine Equity Task Force plan and can take notes from other states on effective ways that they are minimizing these disparities. First, Maryland can adopt an appointment system through call centers or text options to promote access to vaccine registration in addition to online sign-up systems. States such as Mississippi and Alabama have already implemented call centers and scheduling hotlines for residents who are unable to access web-based booking programs, therefore minimizing registration disparities for residents who lack technological or computer access. This can further promote vaccine equity for socioeconomically disadvantaged Black and Hispanic residents lacking internet access. Also, according to a study by the Kaiser Family Foundation in 2021, vaccine registration websites usually allow access to information in different languages, but often only use Google Translate or similar translation software. To improve language accessibility and vaccine equity among Spanish-speaking or Hispanic populations, vaccine registration websites can provide more accurate translated material to ensure easy readability of material and so no important information gets lost in translation. Another barrier to inequities in vaccination is the lack of trust towards government officials and healthcare professionals due to a history of systemic racism. Stories about past systemic racism, including the awful 1932 Tuskegee syphilis study, where Black males with syphilis were deceptively left untreated, has continued to tarnish Black communities' trust in healthcare professionals to this day. To address this distrust, a 2017 study by the Journal of Black Studies found that giving informational video presentations of culturally responsible healthcare practices provided by primarily Black healthcare providers who espoused their commitment to service and philosophy improved Black subjects' attitudes towards healthcare treatment. Similar educational interventions that demonstrate diversity and empathy in healthcare professionals can be implemented in Maryland to reduce vaccine hesitancy among Black and Latin communities. To further improve trust in vaccine uptake among Black and Latin communities, a 2022 study by Dada et al. From the NIH found that trusted channels, including Black and Latino physicians, need to validate and address fears about how racism has historically been embedded into the healthcare system. Also, town halls and outreach events can be hosted where Black and Latino clinicians partner with trusted community leaders such as pastors to convey this information and dispel vaccine myths. Some states have even found it effective to establish vaccine sites at convenient and locally trusted locations, including churches, schools, and even barbershops. Based on the available evidence about vaccine disparities, implementing each of these strategies along with Hogan's current vaccine equity task force is likely to improve vaccine uptake in communities of color.
This is the end of the podcast. I hope you all found this podcast informative, and I really hope you listeners leave the podcast wanting to do your part. Feel free to leave comments below with any questions, or just discuss freely in the comments what you think we should do to help work toward the elimination of racial disparities in Maryland.